In any industry, change is a given. It's not really a matter of if a major change will occur, but when. In the healthcare industry, that major change has come in the form of quality benchmarking. For physicians, that means the adoption of the electronic health record, or EHR. In this new era, practices and providers who learn to adapt are the ones who will thrive, while those who resist will likely find themselves struggling against the inevitable.
There needs to be a critical mass of hospitals and providers that have electronic records. You can't exchange electronically if you don't have electronic records.
Physicians who choose not to adopt an electronic medical record, I think, are going to be left behind.
I have colleagues who are excellent physicians with a paper record, but they just aren't going to be able to keep up with everything that's coming down the road. Certainly, they'll miss out on meaningful use money, but they also are going to find it difficult to deal with the opportunities to be bonused for meeting certain metrics. They're going to find it difficult to communicate with the coming health information exchanges so that they can participate in the care of the patient community-wide in a comprehensive fashion.
While transitioning to the EHR is going to be critical for anyone who wants to stay part of the mainstream medical community, it will also be essential to individual providers at a financial level.
Payment for physicians historically has been based on fee-for-service, as you know, and moving forward, payment will be based on providing quality. And in order to measure that quality, we look at measures of outcomes of patient care. I don't believe it's going to be possible to go into measuring quality without having an electronic medical record.
They're starting to pay us for coordination of care and management of chronic conditions. These things can only be paid if they have some measure that they can use to say, yes, you're reaching a goal or you're not. But we also know down the road, 3 to 4 or 5 years from now, penalties are going to start occurring. They're going to start decreasing your pay by 1%, by 2%, if you're not doing these things. So you really need to get ahead of the curve if you want to be able to get to where you need to be.
Healthcare is no longer measured just by the overall hard work of a provider. It's also about the outcome their work generates. Up until now, the cost of implementing an EHR has been a barrier to adoption, but many have received funding through meaningful use incentives for achieving significant goals in patient care. This means that the cost of implementing an EHR can now be recouped by meeting certain quality standards.
The system is too cumbersome when it's placed on paper, and it's too unpredictable. The physician will need to have the information provided in a very concise, reproducible, electronic way in order to not only meet those incentive payments, but to also do it in a timely manner.
Physicians thought that the meaningful use dollars from the government was like pretend money. We've already gotten one check this year. It's really helping supplement the money we've already spent in implementing our EHR system.
In addition to the meaningful use incentives, an EHR can also provide faster reimbursements and easier accounting.
The turnaround's been much more quick in the reimbursements. We noticed that we went from 1.7 months out in accounts receivable to under 1 month in accounts receivable. That is a significant change that really sped up the cash flow in the practice, and that makes everybody happy when that happens. Physicians feel it's been much more accurate in the coding changes. We know that the reimbursements have changed because coding has become more accurate.
EHRs benefit not only providers, but also the patients. They have access to their personal health information more readily in electronic form, which enables them to better understand their health conditions and the treatments they undergo. More and more patients are becoming aware of EHRs, and studies show they're actually requesting them. Providers who don't adopt EHRs in the near future will be seen as behind the times or disorganized.
My new patients are getting younger and younger because I believe that they see the value of having an electronic presence. It needs to be something that every physician does. And not because somebody's making you do it. You do it because it's better care.
I think it's an important point to show that you're adopting quality in your moving forward in quality management and showing that you're a quality practice and doing the things to improve the patient's care other than just have them show up when they get sick.
Of course, being a healthcare provider means, first and foremost, working to treat, prevent, and foresee health conditions. But as a service provider, giving good service means coordination and organization. It means not making a patient fill out an entire medical history every time he or she sees a new provider. And it means not making a patient drive that extra mile, wait those extra minutes, or pay those extra dollars for tests or procedures that would have been unnecessary had you been able to access their one universal record.
What we see with the changes in healthcare is that the delivery system is going to change rather dramatically over the next decade. When you look forward at a different delivery model, it's going to be important that the electronic health record is foundationally there because of the fact that paper creates redundancy and it doesn't serve the patient well, it doesn't serve the system well.
The EHR makes substantial improvements in efficiency for both the patient and in the day-to-day business of running a successful practice. The EHR can notify staff when routine procedures are needed, like blood work and vaccinations, and all providers involved in a patient's care can access the same information necessary to provide consistent care to that individual. Because care and information are coordinated across healthcare silos, the patient has a better experience. With the EHR, the patient can have a CT scan at an imaging service, then go directly to an appointment with the provider, and the provider will be able to access that radiology information instantly.
Now, I'm of the belief that our productivity is higher because we have electronic medical record. I think I can see patients faster, document it faster, come to better conclusions faster because I have an electronic medical record than I could trying to write the same information in a chart.
Another thing that simply makes our practice more valuable is the prompts that pop up for preventive services, such as, does my patient need a flu shot? Do they need their pneumovax? Have they had their cancer screening? Those pop-ups remind me that they need to be done. And then that's also a stream of revenue that comes into the practice if we provide that service ourselves. We're providing them the right care for the right reason and being paid for it, which is how the system is supposed to work.
Those 2 or 3 cases of people dying from tetanus that occur every year will go away if everybody is immunized against it. And so we can make populations healthier by having prompts in the electronic health record to get those measures done.
While improving care for the individual, the EHR also facilitates the analysis of huge groups of patients that previously would have been next to impossible with traditional charts. With an EHR, the ability to gather and research population data is greatly enhanced. Providers can adapt to conditional incentives by pulling data for a set of variables and working to improve those statistics within a patient population.
I was not able to know how many diabetics I take care of, and I do a good job of taking care of my diabetics. But now I know that I have 264 diabetics. I know that 8% of them's hemoglobin A1C is over 9 and the rest of them are okay. I know that their LDL is at a certain level. I know what their blood pressure is. I know the last time they saw me. All of that is because of the EHR, because it can produce the documents and the reports that I need to be able to improve my care as I take care of a community of patients instead of a single patient.
There's only so much you can do with a clipboard, and you can't do true analysis of large thousands of patients without having the ability to electronically collect and analyze that data.
Having an electronic health record makes a practice more efficient and effective, but it also works to attract new talent. The next generation of healthcare providers are learning and training while utilizing EHRs in medical school. Most new doctors will only want to work for employers who have already adopted an electronic health record in their practice.
As we look at recruiting new physicians, one of the very first questions they ask today is, do you have an electronic health record?
If we didn't have an EHR, they weren't interested. They had learned how to practice medicine that way, and just the thought of having to use pencil, paper, and charts, they just weren't willing to do.
The list of benefits associated with an EHR goes on and on. Improved safety is a huge factor. Charts cannot be misspelled, misplaced, lost, stolen, or destroyed. Everything is located in one place at all times. The electronic health record enables patients to have more control over their healthcare journey. It enables practices to see more patients in less time and gives them better care with measurable results. And it enables providers to earn their living by truly helping people. It's pretty exciting when you think about it, but none of it is possible until you take this necessary step into the future of healthcare. The time to adopt an electronic health record is now. For additional information and resources for EHR adoption, visit 10med.org/adoptehr.